Okay, so today we are going to get started with a lifting threads case. So you can see that this patient has a headband on. She's been thoroughly cleaned. I like to use HIPAA or chlorhexidine to make sure that she is good and sterile. And then I'm just going and using a dry erase marker and I am marking her up. So her main concern was kind of her lower face. So you can see that she's got that jowling area, a little bit of lower face ptosis, and she really wanted to work on lifting that up as I'm demonstrating right there. So I'm just kind of feeling along the zygoma and figuring out my best entry point to see where I'm going to get the best pull, and then just marking my distal points. So marking closer to the chin there will kind of help to pull up that marionette line. And then you can see that I kind of marked into the heaviest part of that jowl and then back along the jawline, which will give her some more definition. So now that she's all treatment planned, I'm going and starting the procedure. So I like to start with just a ComfortTox 0.5 syringe filled with lidocaine. I do like to use lidocaine with epi for this numbing because then the patient is blanched in the area and I know exactly where they're numb. And then the epi also kind of helps with limiting the bleeding that comes from the insertion site. So once they're good and numb there, then I'm going in with a 22 gauge 75 millimeter ComfortTox cannula attached to a 3cc syringe that is filled with just plain 2% lidocaine. And I'm basically creating my tunnels down the vectors of where I'm going to place my lifting threads. So you can see just kind of making my way in, going all the way down, making sure I'm liking the depth that I'm in. And then once I get all the way down to the distal portion, I'm retrograding out and leaving lidocaine behind. This tends to be the most uncomfortable part of the procedure for the patient. As you can see, she's kind of taking a nice big deep breath because it burns. Obviously, lidocaine kind of has that stinging and burning sensation to it for about 10 to 15 seconds. And then after that wears off, usually the patient is really good and numb, so that now, as you can see, I'm going in with the thread. She's very comfortable because she's numb. So the threads I'm using in this patient are Vsoft Arte 1s, the 19 gauge. So the Arte threads are amazing because they're molded, so they tend to be a little bit stronger than the Barb Star threads. And the tip of the thread is actually L-shaped. So as opposed to a sharp tip driving through the tissue, the driver's blunt, and it still kind of has a sharp aspect to it, which helps to get through the plane, but it kind of causes less trauma to the tissue because what's driving the cannula is blunt. So you can see, following my treatment plan, I just put one thread to the marionette. Now I'm placing one down into the jowl. And then once I am all the way down to the distal end, really exaggerating that lift up where I want it to go and pulling out the cannula. So one of the main differences between the lifting threads and the smooth threads is that with lifting threads, once they're in and we're going to remove them, we do not twist lifted threads. Whereas the smooth threads, you definitely do want to twist those before you remove them. So now that I got those two threads placed on the top, I'm moving down to the jawline. I like to just do one area at a time to make sure the patient gets numb, stays numb, but I'm not going to trim the top ones yet until I have the chance to actually sit her up and see what kind of results I got. So just doing all the same steps on the bottom. You can see the little white blanched area was where I numbed her with that lidocaine that was in my ComfortTox syringe. So she was numbed there. I went in with my 18 gauge needle and opened up my pilot hole, and then went in again with my cannula to numb and just place the thread. So now that I have all 3 of those threads in, what I like to do is kind of assess the patient and look at them and make sure everything looks good. And then I'm trimming. So we just use like disposable suture scissors. Those just get thrown out after we use them on the patient. Cut the thread as close to the skin as possible. And then I'm just making sure that she's nice and smooth, using alcohol to make sure the insertion sites are clean. And I'm also checking to make sure that I don't see any of the thread sticking out. But you can see the side-by-side difference, and that was only with 3 threads. So really got a little nice subtle lift. This was her first time getting treated, so I told her if she wants more, she can come back in 4 weeks and do so. But I do think that we are off to a really nice start with her, moving slowly and trying to achieve the results that she is looking for. So she was very happy, and we are going to move on to the next side and do the same thing. So thanks for watching, everybody.